Thank you for watching the video. This is YouTube Medical University. Suddenly, but do you have any at home or are you taking them? Do you have any intestinal regulators such as MiyBM or biofermin prescribed or bought at a drugstore? Maybe you take them for an upset stomach or because they came with antibiotics, but now you have leftovers at home just in case. There might be people like that. In fact, one of my patients told me, "Doctor, I've been taking this intestinal regulator for almost 3 years, but I'm starting to wonder if it's really working." I get how you feel. Hearing terms like lactic acid bacteria or good bacteria makes you think they're good for you, so you keep taking them, unsure if they work. That's pretty common, but taking them without really knowing that intestinal regulator is still a medication, can we really say it's completely safe? You might be taking it to treat constipation, but it could actually be causing diarrhea, or in rare cases, the bacteria from the intestinal regulator could enter your bloodstream and cause a dangerous condition called bacteremia. These things aren't impossible, but it's okay, please don't worry. Watch this video to learn when to take intestinal regulators, how long to use them, and their possible side effects. As a practicing doctor, I'll explain simply. The medicine you usually take, you'll know if your use of intestinal regulators is appropriate, so watch until the end. In this video, I'll discuss their real effectiveness. So, I'll explain from a doctor's perspective when you should take them. And in the second part, I'll introduce the dangerous side effects you should know about. And in the third part, as a practical section, I'll explain the smart timing to stop and how to use them, as taught by a doctor. At YouTube Medical University, we offer videos from a doctor's perspective to help you get healthier starting tomorrow. Please subscribe so you don't forget our channel. So, for the first part, let's talk about the real effectiveness of probiotics. When is the right time to take them? There are probiotics like MiyBM and biofermin, for example. Technically, they're called probiotics. Simply put, they're live intestinal bacteria themselves. Actually, there are hundreds of trillions of bacteria living in our intestines, and that's what we call the gut flora. For example, bacteria such as bifidobacteria, lactic acid bacteria, and E. coli all live together in our bodies. However, some harmful bacteria can cause issues when they multiply. For example, a harmful bacterium called Clostridium welchii multiplies during gastroenteritis, and when this bacterium increases, it can actually cause diarrhea. And Escherichia coli, which is one of the most common intestinal bacteria, can cause urinary tract infections if it enters the urinary tract. And if it gets into the bloodstream, it can multiply and cause a dangerous condition called bacteremia. And these probiotics are given as reinforcements to increase the number of good bacteria, known as beneficial bacteria, among the intestinal flora. Because these medicines help balance the intestinal environment, they're called probiotics, which in Japanese means intestinal regulators. So, when are these probiotics, which act as reinforcements, most useful? That's when you take antibiotics. When you get an infection and take antibiotics, antibiotics are very powerful medicines that kill harmful bacteria, but they also end up killing good bacteria like probiotics. It's like spraying herbicide on a flower garden, which is your gut flora. Not only the weeds, which are the bad bacteria, but also the important flowers end up withering away. Please keep that image in mind. As a result, your gut environment becomes disturbed, which can cause stomach rumbling or diarrhea. This is called antibiotic-associated diarrhea. In situations like this, that's when probiotics actually come into play. Just like planting seeds in a flower garden that has withered due to herbicides, probiotics help increase the good bacteria. By doing so, it's believed that they can help prevent diarrhea. That's the role of probiotics. I think it's easier to understand if you imagine it this way. Now you might be wondering, how effective are they? According to a highly reliable paper called the Cochrane Review, which gathers many studies, taking probiotics together with antibiotics has been shown to significantly reduce the risk of diarrhea. To be specific, if about 20 people take probiotics together with antibiotics, one of them is likely to avoid getting diarrhea. By the way, for children, it's said that probiotics can prevent diarrhea in about 1 out of every 7 to 9 kids. In other words, for adults, even if 20 people take probiotics together, 19 of them will still end up getting diarrhea. It's fine to understand that the effect is only to that extent. However, even if it's just 1 out of 20, diarrhea is tough, so it's natural to hope for some effect. That's why hospitals give probiotics. So, when you're taking antibiotics and are prescribed probiotics, why not make sure to take them properly? Now, for those who wonder if probiotics are effective when you have gastroenteritis, that's a sharp question. It's a good idea to think that increasing good bacteria and improving your gut environment might help cure diarrhea, but there are various opinions on whether that actually reduces diarrhea. A research report from 2010 suggested that taking probiotics might help diarrhea resolve about a day faster. The 2020 Cochrane review found that taking probiotics after getting gastroenteritis doesn't reduce diarrhea duration compared to not taking them. Disappointingly, the duration showed no difference. In other words, if you ask whether taking probiotics during diarrhea from gastroenteritis will definitely shorten the duration for everyone, that's not the case. While it may work for some people, the general conclusion is that you can't expect much effect for most people. Viral gastroenteritis occurs when a virus infects the body, causing the intestines to swell during the immune response. Inflammatory substances are released, preventing proper absorption and causing diarrhea. Instead of improving the intestinal environment, your body focuses on fighting the virus. And it's important to maintain your immunity so you don't get dehydrated when you have diarrhea. In that sense, rather than taking probiotics, it might be more important to stay hydrated and get plenty of rest to support your immune system. So, to summarize the conclusions so far, basically probiotics are most useful when you're taking antibiotics and want to prevent diarrhea. Of course, there are individual differences, so some people might say, I took probiotics and had a really good experience. Or, if your diarrhea improved faster than usual, let us know in the comments. Some say probiotics also help with colds at night or viral gastroenteritis. If you thought that, you might be surprised. At YouTube Medical University, we explain the latest medical knowledge simply, so please subscribe to the channel. In the second period, I'll explain side effects. I know effects differ for everyone, but I feel more comfortable taking probiotics. Since I don't notice side effects, I think some people want to continue using them. However, as people say that medicine comes with risks, even probiotics have side effects. Since you're taking them, I want you to be aware of those risks as well, so I'll be introducing them to you. There are actually people who, by taking these probiotics, have experienced changes in their gut balance and ended up having diarrhea more easily or becoming more prone to constipation. And an even more serious side effect to watch out for is something I mentioned at the beginning: bacteremia. Probiotics are mainly about consuming gut bacteria, right? If these bacteria accidentally break through the intestinal wall and enter the bloodstream, it can lead to a condition called bacteremia. You may wonder, if they're good bacteria, is it fine if they enter the bloodstream? Though they're beneficial in the intestines, these bacteria are foreign invaders if they enter the bloodstream, which should be sterile. Immune cells attack them, causing inflammation and possibly fever. The nutrient-rich blood allows bacteria to rapidly multiply and cluster, creating dangerous situations. In a study conducted at a Japanese university in 2020, out of 6,576 patients in whom bacteria were found in their blood through blood tests, only 5 cases, so in terms of percentage, that's 0.08%, which is quite low. But in that percentage, good bacteria like those found in MiyBM, called butyric acid bacteria, were detected. What do you think? It's a very rare case, less than 1%. So most people basically don't need to worry, but in this study, a certain common factor was found among the patients who developed this bacteremia. In other words, people who fit the 4 characteristics I'm about to introduce have a slightly higher risk of bacteremia even when taking probiotics. So I want you to be careful. First, people with weakened immune systems from medication, such as those on immunosuppressive drugs for autoimmune diseases like rheumatoid arthritis or receiving chemotherapy, are at greater risk of probiotic bacteria entering their system. Second, people being treated for cancer, especially with chemotherapy. Chemotherapy and radiation therapy suppress the immune system and can harm the normal intestinal lining. It is believed that there is a risk that probiotics could cross the intestinal wall and invade the body. Third, people who are born with a weak immune system. This is called immunodeficiency, and if you have ever been told that you have a weak immune system from birth, you also need to be careful. Fourth, people with artificial devices in their blood vessels, like central venous catheters, such as hospitalized chemotherapy patients. People with thin blood vessels and thick tubes inserted in their neck or leg are more prone to bacterial growth and should be cautious. It's very important to be aware, like thinking, I'm taking medication for rheumatoid arthritis, or my family member is currently undergoing chemotherapy. Being alert and noticing these things is crucial. If the probiotics you're currently taking aren't effective and only carry risks, it's better not to take them, right? It also costs money. I hope you'll have the right knowledge and decide whether or not you really need the medication. And when you have a high fever while taking these probiotics, although the possibility is low, there is also a chance of bacteremia. Doctors at different hospitals often aren't aware of medications prescribed elsewhere. For example, I'm taking probiotics from another hospital. Whether or not you share this information can change the diagnosis, so it's very important for patients to have this perspective. I hope this information is helpful. What did you think? Up to this point, I've explained when to use probiotics and their dangerous side effects. If you found this useful or learned something new, it would encourage me if you could leave a like or a comment.
For medical information, Medirudoku.
Finally, it's the last third period. From a doctor's perspective, I'll discuss how to use and incorporate probiotics into our lives. I'd like to ask a question to those who are currently taking probiotics or occasionally take them. What is your purpose for taking those probiotics? It might be a difficult question, but understanding why you are taking them is very important. So from here, I'll introduce smart ways to use probiotics and when to stop based on your purpose. The first purpose I'll talk about today is related to antibiotics. The first is for preventing diarrhea. The second is to improve bowel movements or for vague stomach discomfort. I think most reasons can be divided into these two categories. If you're taking probiotics to prevent antibiotic-caused diarrhea, the purpose is clear. As I said earlier, the time to stop is also clear. It's common to stop taking the probiotic when you finish the antibiotics. Even if you have some probiotics left, you shouldn't keep taking them just because you don't want to waste them. It's not necessary, so basically just take the probiotic while you're taking the antibiotics. You shouldn't keep getting them from the hospital just for reassurance. And the second group is people who feel like their bowel movements improve or want to take it because their stomach doesn't feel well. I think this is the pattern where it's hardest to know when to stop. At first it feels like taking the medicine helped, but it's hard to tell if it really got better because of the medicine. I understand being anxious about stopping, and though the effect is slight, even the constipation treatment guidelines note it. Probiotic digestive medicines may have a slight effect, working for some people but not others. When taking digestive medicine for constipation, among those who took digestive medicine, 57% improved compared to 44% who didn't take it, a roughly 10% higher improvement rate. I want to emphasize that I always recommend trying it for a set period. First, if you have constipation, try taking digestive medicine for about 2 to 4 weeks and see if it has any effect. If you see results, that's good. If not, stop. Even if it helps for a while, you should stop taking it eventually due to possible side effects I mentioned earlier. I've had patients like this. For example, Mr. B in his 40s told me, "Doctor, my stomach hasn't felt right for half a year now. I've been taking over-the-counter digestive medicine, but I feel like gas is building up in my stomach and it's bloated." Mr. B thought that over-the-counter digestive medicine was good for his body because it contains good bacteria, so he kept taking it. But when he stopped taking the medicine, his bloating got dramatically better. So while it works for some people, it doesn't work for others, and for some, it can even have the opposite effect. That's why it's important to use it properly, and then try stopping it. It's important to test and verify what works for you. If you have concerns, consult your doctor or a gastroenterologist. Use this as a reference. Now, let's review the third period. When it comes to digestive medicine, it's important to be clear about its purpose. If you're trying to prevent diarrhea caused by antibiotics, you should take it during the period you're on antibiotics. If you want to improve your bowel movements, it can be hard to know when to stop, so I suggested setting a specific period to take it. In any case, I always say that digestive medicine is not something you take forever. It's a medicine you eventually graduate from. If you're using it without much thought, consult your pharmacist or doctor and consider reducing or stopping it for a while. Now, about unexpected digestive medicine side effects. An easy-to-understand interview-style article was created on a page called Medical Doc. If you'd like to review it in article form, please check it out from the description or the comments section. We're aiming for 1 million subscribers on YouTube Medical University. If you don't mind, please subscribe to the channel so you don't miss any new videos. Well then, see you in the next video.